Botox. So Botox is an anti-aging medication, and it is one of the fastest acting anti-aging medication that is known to humans. It's extremely safe. It's very important to start using it a little early on in life. And what it does is that it prevents your skin from disintegrating. And the way your skin starts disintegrate as you go through time is because of the constant movement, and then at some point your skin just does not have the reserves to grow new collagen and to rejuvenate its internal structures, and then very soon you start seeing that the skin loses its elasticity, and when your skin fails, it falls, and as it falls, it also drags your psyche alongside it. And there is a reason behind your skin impacting your psyche. Remember, chronic skin failure will make you lose the architecture of your face, your skin, the way you know yourself, the way you recognize and perceive yourself. Remember, it's really not about other people. Doing some of these anti-aging treatments is only going to protect your skin from failing and falling and impacting your psyche, because your skin cells and your brain cells, they arise from the same layer when you were only one cell old. So that is the outermost layer. It's also called ectoderm, and it divides into your brain and your skin. So in a way, your skin cells and your brain cells are kind of related, and they do tend to mirror each other. Remember, when you look at you, the only person that is almost impossible to fool is you, right? You cannot fool you. So when people look at themselves, their perception of selves can get distorted by not using these medications, or even by using these medications incorrectly. So not only these medications are very important for people to utilize, but also another very, very important thing is for you to find the people who know how to use them correctly, because a lot of people are just not very good skin tailors. So what you need to do is to also learn who are the best skin tailors in town. What is the difference between Botox and fillers? So Botox is a muscle relaxer. So it basically relaxes your muscle. It's like a meat tenderizer that I like to place usually on the upper part of your face. We put very little bit because we don't want you to have a frozen face. That's really not a great look. It doesn't look natural. People don't feel like themselves, because one purpose of doing this is to help you perceive yourself the way you used to be. So it's like kind of biohacking your brain. Your brain is mirroring itself. Collagen fillers are basically hyaluronic acid fillers. So as you get older, your body, it stops creating fresh collagen. So after the age of usually mid 40s, we start noticing that people have a loss of collagen from their face, and every crease just keeps getting deeper and deeper and deeper, no matter how much you sleep, no matter what kind of vacations you go to, no matter what kind of facials you do. Because remember, your skin not only is like a fabric, but it's also a barrier that you have from the rest of the world. It separates you from the rest of the universe or the multiverse, and nothing can get past it. And the only way to actually currently revive your skin or bring it back to its former glory, or bring it back to when your skin was young and healthy, is through injecting the areas that are losing the collagen. So that is something that is again an injectable treatment, and it is a little bit different than Botox, which is like a meat tenderizer, which is a muscle relaxer. Collagen is basically wherever there is like a very deep crease, or it is something where you've already lost the collagen, we basically inject it in. And again, these treatments are nothing but medications. These are actually medicines. A lot of people think that they're, where can they get the cheapest thing done? And I tell them that, listen, your skin is one of the most expensive fabrics that you will ever own. and getting treated by trained people who know how to deal with these medications and who have experienced thousands of faces before they touch your face is very important. However, depending on your budget, some very super expensive tailors are just super expensive. Are there any side effects after getting either Botox or fillers? Yes, Botox and fillers can have side effects. I sometimes ask people, what is the side effect of you driving the car that you're driving? Now, if you did not know how to drive a car, and if you were unfortunate and you were in front of somebody else who did not know how to drive a car, you can get into an accident, you can get hurt, you can die. However, if you know what you're doing, it's a very important tool that you use to get from one place to the other. Similarly, I heard somewhere once that a surgical scalpel in the hands of a surgeon can save your life, but that same scalpel in the hands of a 2-year-old who doesn't know what they're doing can kill you or themselves. These tools have these medications. These are anti-aging medications. They reverse your skin age. They reverse chronic skin failure for yourself and others. So just remember that somebody who's experienced will not give you any side effects. But there are always the impact of a bruise. You can always get a bruise here and there. But remember, between a wrinkle and a bruise, choose the bruise, because a bruise is going to heal. What is a pillow filler face? So if somebody is aging and their skin is becoming lax and sagging, and they try to reverse it with just filling it with fillers, they may look a bit overdone and they may not even look like themselves. And that is something where we say that instead of getting tightening treatments, they were mistreated. So that can sometimes happen if you go to a provider who does not have more than 1 or 2 tools. So you wanna, because there are several things that will help you. So you have to treat it with not just injectable medications, but also machines. So make sure that your provider also is trained with machines, because it's like a lot of things, so you don't want somebody who just knows how to do 1 or 2 things. They have to learn several different modalities into it, and it can take time. And that's why you want to go to somebody who's very experienced. Now, as far as I'm concerned, I may not be the most experienced, but I've been doing it for 12 years. So, and over the last 12 years, pretty much every year we trained on new technologies. So in the end, they all come together, and it helps us fight off aging for people.